So my topic is Salmonella infection today. What is Salmonella? Salmonella is an infection originating from animals, uncooked food, and also the products that we eat every single day, such as like milk, eggs, meat, fish. And it can also be found in zoos, farms, parks, and schools because it's around people and people could have it that give you symptoms are not that much. So the only symptoms are diarrhea, fever, stomach cramps, and those are the symptoms that would tell you that you have salmonella infection. Risk factors are the children's under 5 could be in a risk. People over 65 could be in a risk. People with weak health could be on the risk because those are the people who cannot really recover the infection, and it would take a lot for them to get better. And people who does drugs also are in risk. Diagnosis and treatment. So salmonella bacteria are found in people's faces, body tissues, and personal fluids. So we never know that when we're gonna get salmonella. The only way that we could prevent it is to be safe and know that everything that we use is clean, especially when we wash our faces or when we go to the bathroom and use the bathroom. And the only treatment that we could do to get better from salmonella are taking antibiotics. But most of the people who has strong body and strong health could really recover that in 3 days or like a week. But other people who are weak um, with their health could take a little more than the ones that are more stronger to recover from the infection. Maintenance are that we have to stay away from raw meats and seafood, poultry to not get the infection. And it's also much better to be clean when handling the food or preparing the food. We always have to know that the place that we cook the food is clean, our hands are clean, and the products that we use to cook the food are clean. Complication. So salmonella are not really deadly virus or deadly infection, but there are some people who can be in danger of salmonella infection, such as babies, young children, older adults, transplant patients, pregnant women, and those who are promised immune system. And the rest of the people could be recovered in some days. Prevention. Being cautioned by prevention, the intake of raw food, washing hands throughout the day, preventing cross contamination, avoiding consuming raw meats, dairy, and egg products, wearing a mask, and washing hands after touching or coming into contact with animals. So we should always be um, careful on being clean when we're doing something such as like having an animal with us. We always have to wash our hands and be clean after touching the animal because those are the only ways and the easy ways that we could get the infection right away. So it's always better to be careful what's around us and who we have conversation with because we never know that the people we have conversations with could have the salmonella and just give it to us.